Hello, welcome to Exploring Change. This is an education group where we're going to be talking about perspectives on substance use, hopefully to help you make a decision about whether or not substances are a problem for you. My name's Christina. I'm an addiction and mental health counselor. I work for Addiction Services of Thames Valley in London, Ontario. So in this session, we're going to be talking about the following things. What do problems look like? How do problems develop? How do I know if I have a problem? How do substances affect me or the body, like blood alcohol concentration? How do I compare to other people? And how can I get help? At the end of this presentation, I'll tell you about our various services and what options are available to you. For today, it's not about telling you if you have a problem or not. Today's just going to provide you with some information so that you can make an informed decision. So these images are just a visual tool to kind of illustrate how we can see things in more than one way. Looking at the picture on the left, depending on how you look at it, you might see a person playing a saxophone, or you might see the image of a woman's face. And similarly, the picture on the right, you might see an image of an older woman, or if you look at it in a different way, you might see a young woman wearing a hat. So looking at things in different ways, I guess, can occur with substance use and addiction as well. So what looks like a problem for one person might not look like a problem to another person. And we're going to be talking about these different perspectives today in our session. So what do problems look like? Well, it's important to remember all problems can be helped. There's always something that we can do to make things a little bit better. It might not fully solve the issue, but at least we can reduce some of the consequences of substance use. Problems can, of course, become more serious if nothing is done. Kind of like with a snowball that's pushed down a hill, it quickly gathers more snow and becomes bigger, and then it's harder to chip away at once it's kind of gained a lot of mass. And substance use works the same way. Sometimes if we don't address the problem as it's growing, it'll continue to grow and get worse and be much more difficult to address down the line as opposed to intervening more early. It's also important to remember that some people will choose to live their whole life with problems, and that's their choice, and they acknowledge it. There are some ways you can tell, or look for early warning signs, I guess, of a problem that's beginning to develop. So if a person is having arguments with their family or their loved ones, or there's a lot of relationship strain, legal problems are very common. People might be involved in the legal system or have substance-related charges. People might also be charged with things while they're under the influence, or they might do illegal or dangerous things to obtain their substance. Financial problems are very common because using substances can be very costly and cause strain or debt, and health consequences too. Substance use can cause a variety of health problems. For example, problems with the liver, various infections, or a weakened immune system. So how do problems develop? It could be from a family history. Maybe a parent had a drinking problem. We know that if there's a history in the family, especially for alcoholism, a person is more likely to develop substance problems or addiction. Could also be a learned behavior. Like, for example, if you saw a person in your family as you were growing up cope with difficulties by using substances, you might be more likely to sort of follow suit as you get older yourself. It's very unclear if substance use is more caused by nature or nurture. So the way a person's genetics are or the way they were raised, we do know there is some heritability to addiction. So if you have a family member who has addiction, you are more likely to develop addiction. Another at-risk factor, I guess, would be drinking before adulthood, like drinking regularly. The earlier someone uses a substance or alcohol, the greater likelihood they are to develop a problem later. Cigarette smoking. A large percentage of individuals who have a problem with substances also smoke cigarettes. Non-medical use of drugs means a person's using prescriptions that are not prescribed to them. So, for example, using a friend or family member's prescription for a toothache. Mental health issues, they could be undiagnosed, they could be treated or untreated. Sometimes this is called concurrent disorder, where a person has a mental health issue and a substance use issue at the same time. And of course, history of trauma. There's a strong connection between individuals who have experienced some type of trauma and substance use. Sometimes people will use drugs or alcohol to cope with the memories of a trauma or the effects of trauma that still affect them today, like anxiety problems, sleep difficulties, and so forth. So how do I know if I have a problem? We use the stages of change model. And this is a model that outlines the process people go through when they are determining if they have a problem with a drug or with a behavior and how to change it. So we're going to go into these stages more specifically. The first stage is pre-contemplation. Usually in this stage, a person is seeing more positives than negatives to their substance use. They're probably not very interested in making a change. They might actually be kind of defensive of their use, even if other people tell them that they have a problem. The next stage is contemplation. A person is more aware of the consequences of their substance use. They're looking at the balance between positive and negative outcomes, and they're thinking about making a change. Preparation is the next stage, where a person is beginning to look at options available to them for making a change. So it might be making a change in their behaviors individually, might be thinking about how they could make a lifestyle change, or they might be collecting information about where they can go to get help. The person is intent on taking action and making a change. And then the next stage is the action stage where a person follows through. So they're actively involved in making changes to their behavior or their substance use, and the new behavior has more positives than negatives. Maintenance is a stage where a person is working towards sustaining the changes they've implemented. They're beginning to acquire new skills to avoid lapse or relapse. And then after that, we talk about the termination stage. This stage can be considered controversial. The person generally will have a high degree of confidence that they're not going to return to previous behaviors that were destructive or harmful. They tend to have very few or no urges or cravings. They've reduced their risk behaviors significantly. They might feel as though they are recovered in a way, but for some people, they might feel they're not able to enter this stage because they might view it as permission to use again. And if the stage of termination doesn't fit well in your recovery philosophy, that's okay. Termination is not part of the 12-step philosophy either. And looking at chance of lapse or relapse. Lapse would be like a smaller, I guess, how am I saying this? Lapse would be like a slip, I suppose. So for example, running into your drug dealer or the person you used to drink with, and maybe you use once or twice together or alone. Relapse is more like you've returned to the previous destructive patterns that you had before. So it can be a really slippery slope heading back into those substance use behaviors. Um, and sometimes that can lead you back to physical or psychological dependency as well. Another good way to look at this, I guess, there's an author called Dr. Stephen Melamis. He is an addiction specialist, and he writes about the stages of relapse in the following sort of way. So you move from emotional to cognitive to physical relapse. Emotional relapse is when you are in the sort of head space that you were in when you previously used. So feeling lots of stress or sadness or whatever were the emotions that you had when you were previously using. You're not even thinking about relapse at that point. And then cognitive relapse occurs when you might start to plan or think about reasons to use again. Physical relapse is when you actually go and acquire the substance. So that's another way to sort of look at the process of lapse or relapse. So why do people get stuck in the stages of change? The person might be confused about their reasons for making a change. They might know they ought to or they should, but they don't know why. They might be looking at someone else's reasons for making a change. They're going through making the changes, but it's not for them. It's because someone wants them to or told them that they should. They might not be seeing their substance use or their gambling clearly. They might not be looking at the substance use consequences realistically or recognizing how much of a problem it has been. Could be that their goals are unrealistic or they're not being fair to themselves. Sometimes in recovery, people want to make changes all at once. They want to change everything immediately, and that's not very realistic because good things take time. Trying to change only part of the problem. So sometimes a person will want to stop using, but they might still hang out with the friends or family members who are using in front of them, and that puts them at very high risk of lapse or relapse, or it might not sort of move them along the stages of change. Actually has the opposite effect. Being unclear about what they want to change or how they want to change, like maybe not knowing how to go about it. Being overwhelmed with the unexpected can also get us stuck in the stages of change. So we know there will be bumps in the road, but sometimes we don't know how to deal with them. And the unexpected can be very scary for some people, and it can be enough to lead them away from their recovery path. Other reasons people get stuck in the stages of change is because they're impatient. Like it can take a long time sometimes to make changes in our substance use. People might get frustrated if they're not seeing the outcomes that they want to see right away, and they might lose motivation. For loss of motivation, it's important to set small, realistic goals for yourself as opposed to, having a really, really big goal trying to achieve that all at once. It could be maybe just reducing the number of drinks you have in a week by one. That would be a good start, and it helps you build momentum over time. Not learning or practicing new behaviors could be another reason people get stuck. So, being resistant to learning new ways of coping will hold you back. If you attempt to change your substance use without learning new coping skills to kind of replace the function of the substance, you might not be able to achieve the success that you want to. Not modifying the plan as needed. So if you go into your recovery with only one plan and are resistant to changing it, you might not be as successful as you hope because you kind of have to adapt your plan to the challenges that life presents you with. Not being aware of all the options available to you. If you don't know what's available to you, you might not have the tools you need to approach your recovery goals. And then not liking the options available to you can sometimes be a reason people get stuck. Um, Maybe they haven't looked at all the options, or they're in a place where options are very limited. So it's important to look at a variety of treatment approaches. You could look at 12-step recovery, so things like AA or NA. You can look at self-help books, self-help websites, message boards, community treatment like addiction services of Thames Valley, residential treatment, addiction medicine, and so on. There's lots of different options. This slide is a little bit hard to see because the text is not showing, but essentially what it's supposed to show is the continuum of substance use, which is a model that we can use to sort of demonstrate how people move up or down the continuum of substance use through their lifetime. So on the one end, at the far left, we have no use, all the way up to the very far right, which would be physical and psychological dependency. So, of course, a person begins their substance use journey with no use. They have never used or are not using a substance. And then they might begin with experimentation. It could be they try it once and stop, or they continue to experiment with the substance. Recreational use would be the next step where a person is sort of getting together occasionally to maybe have a few drinks or to use together with other people. They probably won't have a lot of negative impacts on their life at this point. They're able to sort of manage their day to day. Regular use would be the step after that. So this is where we tend to see substance misuse. Using on a more regular basis can also put you at risk of using to cope. So if you tend to involve a substance in your life regularly, you're more likely to tend to rely on that substance when you're in a period of high stress, which can be good stress or bad stress. After experimentation, recreation, regular use, we see problem use. This can also be called substance abuse. Here we have negative consequences. It's not necessarily to the point where a person cannot manage. It could be that a person's using daily or even weekly, but they're able to sort of meet other obligations like for work or school or things like that. Sometimes you might hear the term functioning addict, where they're able to get through their day, but then maybe they come home and then they use all night, but are still able to get up and go to their day the next day. After problem use, we see dependency. This is where a person has become dependent on the substance. Their entire life will revolve around acquiring it, sometimes activities to get money to sustain the substance use. There will be a lot of negative consequences at this point. Usually, a person will have difficulty with relationships, like with family, with their children. They're not able to meet their basic needs a lot of the time, like they might be late on rent or their budget for groceries is affected. They might have to take out a loan. Usually, you'll see deteriorating physical and mental health. Sometimes a person will have legal charges related to the addiction, financial problems, unable to attend appointments or work, school, and so forth, because the person's life is completely revolving around the substance. So when we say psychological dependency, we mean the person's brain tells them that they need it. And physical dependency is when a person actually starts to get sick if they don't have the substance on board in their body. So this can be kind of good opportunity to take a look at how you perceive your own substance use on the continuum and maybe where other people in your life would see where you're at on the continuum. Another way to look at if you have a problem could be the decisional balancing tool. So this tool can be helpful to consider both the positive and negative aspects of making changes to substance use. So you take a piece of paper and you create a quadrant, like a box with 4 squares. And in the top left, write down your reasons or the benefits of using the substance. On the top right, put down your reasons or the benefits of not using that substance. On the bottom left, in that quadrant, write down your experiences of negative consequences of using or negative consequences you could be facing if you continue to use. And in the bottom right, write down the negative side of not using. So like the things you might have to give up. So this exercise can be helpful to understand that substance use has both positive and negative aspects. For example, a substance might really help us cope with stress, but it costs too much money. Another example could be we feel physically better when we stop using a substance, but it really affects our relationships because we're not able to hang out with the family members or friends because maybe they still are using that substance. So looking at how do substances affect me, when we talk about a substance, we're talking about a drug. A drug is a substance which is taken with the intention of producing a desired change, or it changes the way the body or mind functions. And you can break down substances into categories. So basically, drugs and alcohol will affect the central nervous system. It's our brain-body connection. It's how our brain communicates and sends signals within the body. Substances will affect those signals and the messages our body receives. So when you look at something called a depressant, that will be drugs that slow down the central nervous system, like alcohol, opioids, and benzodiazepines. When you're looking at stimulants, these are drugs that will speed up the central nervous system. And some examples of that would include cocaine, crack cocaine, amphetamines, nicotine, caffeine, crystal meth. Hallucinogens, this category of drug will distort the central nervous system, altering our visual, auditory, and tactile perceptions. And then you have dual effect drugs like ecstasy and ketamine, where they have elements of different categories of these drugs. And another interesting drug that has sort of multiple effects would be cannabis. Cannabis has elements of all 3 of these categories. So when we talk about physical dependency, we're talking about how the body has grown accustomed to the presence of that substance at a particular amount. And when that amount is not achieved, the person will experience physical withdrawal. Withdrawal will usually present as anxiety, sleeplessness, sweating, tremors, aches and pains, muscle spasms, nausea, and hallucinations. The best way to think about withdrawal is it's going to look almost like the opposite of what you will experience when you're using. So let's look at, like for example, alcohol. Alcohol is a depressant. It slows down the central nervous system. So a person might feel relaxed, their thinking might be a little bit slower, they might feel sleepy when they're drinking. But then when they're in withdrawal, you're going to have the opposite effect because the alcohol is not present to slow down the central nervous system, which is what the body has grown accustomed to. So you will see things like tremors, shaking, um, insomnia, anxiety, those types of things. When we talk about psychological dependence, that's the emotional or mental preoccupation. When a person is dealing with dependency, it's very hard to think about anything else, very hard to concentrate. Their day is often structured around their substance and how it makes them feel. And then when we talk about tolerance, that means more of a substance is needed to achieve the same effect. So sometimes there will be factors that will influence the substance of choice that we have or the types of drugs that we consume. So when you think about your friend group, the people you hang out with, if they tend to drink alcohol, you might be more likely to drink alcohol. Your previous experiences with substances, if you had a bad experience, you're probably not likely to repeatedly use that substance, but if you had a good experience, you might be more likely to try it again. The type of high or desired feeling, a person might tend to use a substance to produce a specific effect that's desirable to them for whatever reason. Lifestyle, so for example, people who work in jobs that are very centered around alcohol might be more likely to use alcohol because it's sort of part of the lifestyle and culture of that workplace. Or if a person is really into rave or party culture, they might be more likely to use stimulants because that's just part of the lifestyle or culture of that group. The degree of social approval or disapproval might affect whether or not a person is likely to use a certain drug. There are certain drugs that are deemed less okay or more okay, less acceptable or more acceptable, depending on where you come from or where you live. So, for example, alcohol and nicotine are legal in Canada, but in other countries they're not. Availability or cost, this is going to play a huge role in what drugs a person uses because if they can't afford a certain substance, they're not likely to use it. People might also change their substance use based on what they can afford. And then the degree of control over the effects. Some people will find sort of a therapeutic or benefit, um, therapeutic effect or like a benefit of using a substance. So certain substances will take you more out of your headspace than others. And when I say taking you out of your headspace, I guess I mean sometimes people are under so much stress that they would rather not think or feel at all. And the type of substance they choose might be to medicate or alleviate some of that stress. So let's talk about how different substances affect the body. The first one we're going to start with is alcohol. So when we talk about blood alcohol concentration, we're talking about how alcohol is metabolized in the body. It's going to determine, I guess, the degree of impairment. So factors that will influence your blood alcohol concentration, your body weight. So the heavier a person is, the lower their blood alcohol concentration would be, given the same amount of alcohol to like compared to someone who weighs a little less. How much you drink obviously is going to affect how impaired you are and your blood alcohol concentration. And your gender does play a role. This is just a general rule. Females do tend to have less water and more body fat than males. This means that the blood alcohol concentration for women can be as much as 30% higher than in males of the same weight. There will be other factors that will influence your blood alcohol concentration to a small degree, but these are the most important factors. And it's also important to remember not to confuse tolerance or feeling okay with your blood alcohol concentration. So just because you might feel okay or you might not feel the effects of the alcohol because of your tolerance, it doesn't change your blood alcohol concentration. Okay, so what does it mean to have one drink? Like, how do we know what is one drink? So standard drinks, it's kind of hard to see because the font is really small, but a standard drink is going to be about 1.5 ounces of liquor at about 40%, a regular strength or 5% beer at about 12 ounces, and a glass of wine at about 5 ounces. Sometimes when you go to a restaurant, the glass is pretty large. It might actually not be one standard drink. So it's important to kind of begin measuring or thinking about how much you're drinking when you're looking to begin making changes. Sometimes people find they experience alcohol effects differently with different types of alcohol, but it might also just be the way they're consuming the alcohol. There are some drinks that are really hard to measure. So for example, like a punch is really hard to measure how many standard drinks that is. Shooters or mixed drinks, unless you measure them. And like we talked about wine glasses that don't have the standard 5-ounce size. And draft, so you might be splitting a pitcher of beer with other people, or you might have your drink topped up. Okay, so looking at blood alcohol concentration, just generally speaking, when we're looking at some of the effects of blood alcohol concentration, these are some examples of what we might see based on a person's BAC. I'm going to see if I can move this video over. Okay, so looking at 0.05, a person's probably going to have mild intoxication and mild impairment. They'll probably feel relaxed. They might have slightly poorer judgment. And if they were pulled over and driving, they could get a warning. At 0.08, usually a person will be clearly intoxicated. And if they're driving and pulled over, they would probably receive an impaired driving charge because that's the legal limit in Ontario. Let's see. Okay, so 0.15, a person's generally going to be very intoxicated. It'll be obvious in the person's movements, in their speech and their emotion. At a level of 0.25, person's going to be very intoxicated, probably not feeling good at this point. 0.35, serious risks of alcohol poisoning, coma, health problems. And then BAC of 0.5, death could be likely at this point. Like we discussed, alcohol is a depressant, and it might cause the nervous system to slow down so much that they actually reach respiratory failure. So this is an exercise where we can look at the blood alcohol concentration of just an example person. So we're going to be looking at the example of a 160-pound male and a 160-pound female to kind of see the differences between blood alcohol concentrations. So the top row here with the darker blue, this would represent the number of standard drinks that a person has. And then the column on the left here, I know it's hard to see because the font is white, but this will be hours past. So an example of maybe someone coming to an event or an occasion, if they have 4 drinks, this 160-pound male having 4 drinks, it would take about 5 hours to metabolize that down to about 0.04. For a female of the same weight, it would take, let's see, 4 drinks, it would take between 6 or 7 hours to metabolize that down to about the same level. Another example, if this 160-pound male has 3 drinks, it will take about 6 hours for that blood alcohol concentration to go all the way down to 0. For his female counterpart, we're looking at 3 drinks. It's going to take about 7 hours to reduce that down to 0 to fully metabolize the alcohol. So if a person were to have 9 drinks, like a male at 160 pounds, if he were to have 9 drinks, after 7 hours, his blood alcohol concentration is still 0.14. And even if he doesn't feel impaired, because he might have a tolerance to alcohol or a lot of time has passed, his blood alcohol concentration would reflect that he is impaired. He's above the legal limit. For a female of the same weight, after having 9 drinks, after 7 hours, her blood alcohol concentration would still be 0.185. So hopefully this tool is useful in illustrating that metabolizing alcohol takes time. And even though you feel okay or a lot of hours have passed, it does not mean that you're okay to drive. So thinking about low-risk drinking guidelines, or sorry, let's go back here. Like we had said, often we don't realize how long it takes for alcohol to be metabolized out of our system. And for some individuals who might drink heavily over multiple days, their blood alcohol concentration might not reach 0 before they start drinking again. And as a result, their blood alcohol concentration could be compounded. So let's say a person had been drinking heavily in one day and their blood alcohol concentration had reached like 0.3. It would take about 20 hours then to have a blood alcohol concentration of 0. So let's see here. In this chart, it's kind of hard to see. So 300 around here, hours to have 0 BAC, about 20 hours, like a whole day. This is often where people will run into trouble with impaired driving because they're feeling okay. It's been a day since they've drank, but their blood alcohol will still be over the legal limit and their body is still trying to clear away the alcohol. So let's move on here. Thinking about low-risk drinking guidelines, some of the recommendations obviously would include not drinking at all, having some days of abstinence in between your drinking days. If a person is measuring their drink sizes, that can definitely help reduce like impaired driving because you know how much you've had to drink. You know when you're ready to go if you kind of practice a little bit with those blood alcohol concentration charts. You can also do a quick Google search and find a BAC calculator and kind of implement in like, okay, I had this many of this type of beer, I weigh this much, I am male or female, kind of do it that way. Canada's low-risk drinking guidelines, they say no more than 2 standard drinks on any one day. For women, up to 10 standard drinks in a week, and for men, up to 15 standard drinks in a week with no more than 3 drinks a day on most days. So let's look at other substances. Cocaine and crack cocaine. How will this affect your body? It can often give us a feeling of euphoria, really high energy. Often people are really talkative and quite alert, but a very high dose can cause feelings of panic, paranoia, hallucinations, and erratic or bizarre or aggressive behaviors. It's really important to remember that when we're using, our perception is altered. So for you, you might think you're presenting okay, you might think you're quite charming or, you know, just in a really good mood or high energy, but other people might perceive you to be erratic or odd. So you can always ask a trusted friend or a family member to give you feedback about your behaviors, and it might give you some insight into whether or not you do have a problem. Thinking about harm reduction approaches for cocaine and crack cocaine. If you are snorting cocaine, don't share a snorting device or a straw because you can transfer I guess, bacteria and germs between you and the other person, especially if you have any kind of bleeding or tearing in your nose. You can also use saline rinses to avoid infections if you think the cocaine you have is contaminated in some way. If you are smoking cocaine or smoking crack, try to always use your own pipe. You can get free pipes at regional HIV/AIDS and other harm reduction supply places. You can also go to a convenience store and get a new clean pipe for fairly cheap. Take breaks too and limit your use. Sometimes setting a budget can be helpful. If you take breaks, like tolerance breaks, when you're using cocaine and crack cocaine, you might find you need less of that substance to achieve the same effect because your body has had a tolerance break. Another substance, cannabis. So people will have very different experiences with cannabis. Some people say they feel very relaxed. Some people say they feel really talkative, very tense or anxious. A really high dose is more likely to kind of amplify those negative effects, where a person might feel they're losing control, they might feel confused or paranoid. Some people will have hallucinations or really severe drowsiness. So some harm reduction strategies for cannabis would include obviously measuring your dose first, so you know how much you're consuming. Pay attention to the label. So if you're purchasing from the Ontario Cannabis Store, read the label, read the ratio of THC to CBD. If you're not sure what that means, you could do some Google searching or ask one of the clerks to kind of explain it to you. Essentially, what you'll find is that the higher the ratio of THC to CBD, the more likely you are to experience some of those negative effects, like losing control, um, feeling really sedated. You might also feel a little bit paranoid or have kind of odd thoughts and things like that. So pay attention to the label. And if you're not sure, ask. If you're purchasing from a friend and it doesn't have a label with the THC and CBD ratio or the strain or like where it's from, ask your friend, do they know what strain it is? Often a very quick Google search, less than 30 seconds, you can search up the strain and it'll tell you the ratio of THC to CBD, and you can kind of measure your dose based on what you read. Right, moving on. So opioids. When a person's taking these as prescribed, they can be safe, but taking them in other ways can be really dangerous. And some of the dangers include opioid overdose, becoming physically dependent, a lot of withdrawal symptoms, risks of infection depending on how it is they're using, and self-medicating for pain. Harm reduction strategies for opioids: do not crush them or chew them, try not to crush or snort them, try not to inject them, try not to combine them with other substances, and try not to take opioids by yourself. So thinking about how I compare with other people, the following statistics are obtained from the Canadian Tobacco, Alcohol, and Drug Survey, which was conducted in 2017. You can find it on this Canada website here. The study had about 16,000 participants, and what they did with those 16,000 participants of different ages, ethnicities, different groups, I guess, they sort of extrapolated the data to make inferences about the population. So we're going to be talking about the data from this study specifically. This one here is from CAMH, which is a monitoring report, I guess, about Ontario specifically. So the percentage of Ontario adults who consume alcohol on a daily basis, 7% of people who consume alcohol reported that they did so on a daily basis, and 93% of people who reported consuming alcohol reported they did not do so on a daily basis. So according to that big survey that we talked about at the beginning, about 90% of Canadians reported that they have used alcohol in their lifetime. And about 78.2% of Canadians reported they used alcohol in the last year. And of that 78%, 16% exceeded Canada's low-risk drinking guidelines that we talked about before, So that means people were consuming more than 5 drinks in one day for men and more than 4 drinks in one day for women per week. So that's kind of what it looks like in a visual aid, I guess, on this pie chart. So thinking about problematic use, it's about 16% of the people who reported drinking within the last year. And then 83% of people who used alcohol in the last year were using at or below Canada's low-risk drinking guidelines. So how many Canadians have used cannabis or use cannabis? About 46% of people said they used cannabis at some point in their life. 53% of people had said they never used cannabis. 14% of people have used cannabis within the last year, and 85% of people reported they have not used cannabis within the last year. Looking at another drug, cocaine or crack cocaine, according to this big survey, about 10.4% of people reported they have used cocaine in their lifetime. 89% of people reporting they never used cocaine. And then thinking about people who have reported using in the last year, the last 12 months would be about 2.5% of respondents. 97% of people reported that they have not used cocaine in the past year. So according to the Canadian Tobacco, Alcohol, and Drug Survey that we talked about 2.9% of Canadians reported they had used opioids for non-medical purposes in the past year. So that means reasons outside of the prescription. So most likely it was not prescribed to them. So thinking about whether or not I have a problem, or how to get help, I guess ask yourself these questions. Do I have a substance use problem based on what I've learned today? And if so, how much of a problem is this for me or for other people? What can I do about it? What will it take to change the problem? And only you can answer these questions. When you decide, if you decide that you want to get some help, there are different pathways you can take. Sometimes people in their substance use journey will choose to abstain from using altogether. That means they're stopping their use. This could be for a period of time, or it could be sort of ongoing. Some people might also pursue a goal of moderation or harm reduction. This would be more about controlled use and safer use. And then also you could look at not changing at all. Maybe from what you've learned today, you've realized actually your substance use isn't a problem, or maybe the reasons for making a change were not your reasons, they might be someone else's. So if you decide to get counseling, the counselor will work with you based on your goals, not the counselor's goals, but where it is you want to go. And some people also come to counseling for education as well. So it might not necessarily be to make big lifestyle changes, it might be just to get some information, and that's perfectly okay. The decision is yours. Only you can decide. Like what factors in your life do you need to consider changing? Or what factors in your life do you need to consider before you begin making a change? So it could be your work, your relationships with family, your lifestyle, your social environment, your health. What are your personal costs and benefits? What do you have to gain by changing? So if you're interested to get some help or to get some information, you can call us for services in Elgin County, Oxford County, Middlesex County, and London. Our intake line is running right now Monday to Friday. You can call between 10 a.m. and 3 o'clock p.m. We might not be able to get to your call right away, but we usually respond to you and we'll arrange for you to complete an intake or speak with a counselor, usually within 72 hours. So for intake and support, call extension 222. If you are a concerned significant other, or you're looking for information about support like family group, you can call 284. And we do have other programs as well. I would encourage you to look at our website, ADSTV.on.ca. You can look at withdrawal support options. We have other options like addiction medicine and services in French as well. You can call 271. So that's our presentation for today on exploring change. I really hope that this can be useful to you in making a decision about your substance use or give you some information about a concerned, or rather, if you are a concerned loved one. If you have questions, please feel free to give us feedback. And if you are interested in services, you can call or email our intake line. Definitely check out our website and social media for more options on how to get connected with us or other services. But yeah, that's our presentation. Thank you for your time. Maybe see you soon.